Okay, good evening, everyone. My name's Matt Sharp. I'm the Chief Executive at Golden Valley Health. Welcome. Apologies, we've had a little bit of a delay. There's been a few technical issues in trying to make the connections and get us all in the right place in the virtual room and in virtual environment. And also, unfortunately, we haven't been able to arrange the connection with our Facebook live stream that was planned. So our apologies for that. Before I go any further, I'd like to acknowledge the traditional custodians of the land on which we're all gathered and pay my respects to elders past, present and emerging, and any First Nations people who are joining us in the call today. We have some time scheduled now. We're a little bit going through till 7:30. Tonight, I'll just provide a brief update in regards to what's happening with the outbreak in Shepparton at the moment. And then I'll hand to Professor Paul Johnson. Paul is the Director of the North East Melbourne Public Health Unit, and Paul's been seconded up here for this week and helping us in terms of oversight of the outbreak and related issues that we're trying to manage. And then we'll hear from Dr. Fung Pham, who's the Deputy Secretary of Engagement and Delivery. And Fung's also been really closely engaged with us this week, particularly as we try and establish the testing teams and sites in the last few days. We're going to move through our updates as quickly as we can so that it allows all of you that are participating in this live stream the chance to ask us questions. You won't be able to ask us any questions from coming off mute and in a live interactive way. The way that we can do it is have you pop your questions into the chat function. So please start putting questions into the chat function anytime something pops into your mind, and we're going to theme those questions and respond to them at the conclusion. So we'll try and get to the questions around 5 past or 10 past 7, so we allow plenty of time to work through those items. So just in terms of updates of where we're at with the outbreak itself, at the moment we have today 44 positive people who have tested positive for COVID-19 that are active cases in the community. Based on what we're seeing today, that number will increase overnight, and we expect tomorrow it probably be up to 50 or more people that will be considered to be active cases. In terms of targeted testing, all of this information that I'm going to share with you now is available on my Facebook page and also the GV Health Facebook page. So please follow those pages if you haven't already done so. We're trying to use those platforms as a really quick and easy way to provide information to the community as well. So please follow us, because that's proving to be fairly helpful in getting information out to people. Tomorrow we are targeting testing for some certain school groups and other areas that I'll mention in a minute, but certainly at the moment, now that we've got greater capacity at our testing sites in Shepparton, we are really encouraging, of course, at any time, this is always the case, but even right now at the moment, anyone who has symptoms of COVID-19, flu-like symptoms, cough, scratchy throat, runny nose, etc., we want you to come forward and be tested. Don't delay in that. Don't put it off for half a day, an hour, or whatever the case might be. Please come forward and get tested straight away. Some priority testing for us tomorrow relates to the whole of the St. Mel's Primary School campus, the Greater Shepparton Secondary College Maguire campus, the Sky Salon Hairdressing premises at 40 Vaughan Street, Shepparton. This is a relatively new exposure site that we're calling out. It is for anyone who visited the hairdressing salon, Sky Salon, from the 15th to the 20th of August inclusive. We'd like you to come forward to be tested as soon as you can. It's a tier 1 site, and we know there's been some transmission at that venue, and that's why we'd like you to come forward for testing as soon as possible. Last Friday, the 20th of August, MARUTNA Primary School and MARUTNA After School Care Program, that includes students from St. Mary's MARUTNA, only the students that go to the after school program, not the whole St. Mary's school community, that we'd like you to come forward for testing as well. All of the testing locations are available on our Facebook pages, and including their opening and closing times. We now are able to offer testing at 2 sites in Shepparton, one site in Shepparton and one site in MARUTNA that are now open till 8 o'clock each evening as well. So hopefully that's going to improve some access for people. In regards to our normal hospital operations at GV Health, like all of the different businesses and premises in Shepparton, we've been fairly heavily impacted in relation to furloughing of staff, or people, we describe it as furloughing, but that actually means the people can't come to work. So the staff who have been to certain exposure sites that are required to quarantine. We have over 420 staff now that are not able to be at work at the moment because of being in certain locations and exposure sites. That is having an impact on some of our services. However, we have redeployed people to work in what we are considering our critical services, such as our emergency department, our wards, certainly the COVID testing, and also contact tracing environment. We're expecting some help to arrive from Melbourne tomorrow to support our staff, who are doing a fantastic job, but we do need some support right across those critical services. So for those areas where we've had to cancel people's appointments this week and possibly next week, I'm sorry about that. However, we just have to divert the people and resources that we have to really get on top of this outbreak. So we're going as fast and as quickly as we can to get on top of the outbreak. And we're also really focused on maintaining those critical services to the community from our hospital sites and mental health services, among others as well. I'll now hand over to Paul Johnson, who's going to provide us some information about some more specific details in relation to the outbreak and what's occurring in relation to how we can reduce transmission risk and a few other key things. So I'll hand to Paul and we'll go from there. Thanks, everyone. You're on mute, Paul. Sorry, I couldn't see that. I can't quite see. Oh, Paul needs to be allowed to communicate, please. There we go.
Hello, thank you very much. And good evening, everybody, and thanks for your time. And thanks, Matt, for that introduction. So I'm Professor Paul Johnson. I'm an infectious diseases specialist. I've actually worked with Shepparton last year when I was involved in setting up the regional public health units. And I remember in October 2020, as a town and as a public health unit, you did a fabulous job in cutting down in its stride an outbreak very, very quickly. So you've done this before, and you've got a good reputation for being really good at this as a town and as a public health unit. Now, last time in October 2020, we were dealing with the virus that is sort of Wuhan original, but what we've got now is Delta. So just a couple of examples of how it's different. Last year, the virus would take about 5 days to regenerate itself. And for most people, if you went into a household with a case, about a third of the household would be positive and everyone else would be okay. Delta is really a different beast. It can regenerate itself in just 2 days. So that's 48 hours. And when you find a household where Delta has arrived, everyone is either positive or about to become positive. And it's evolved, so it sticks much better to humans than it did last time around. So while we're all good at this in Shepparton, we have to be even better this time. And you can sort of see that it's grown really, really quickly. It's only been here for a short time. So as Matt said, there was 44 cases. I think it's actually already gone up to 47. But there are no genuine mystery cases at the moment. Everything is linkable. It's across at least 15 households. And the number of primary close contacts is really large because of the involvement of schools. So we're going very fast for the contact tracing. The lockdown has been really effective. And we hope that we'll be able to catch up. But we're all in this together. And what we have to do is, as a whole city and region, we have to follow the lockdown rules, reduce as much as possible as contact with people, only go out for the known reasons. If we are have any symptoms at all at the moment, there's no other viruses around, it'll be COVID. So if you've got symptoms, go forward, as Matt said, immediately. If you're caught up in, if you've been to an exposure site, it's important to follow the rules, and it's important to keep an eye on those exposure sites. If you're already in quarantine, it's very important that you stay in quarantine, you know and understand the conditions. At this time, because of the very large numbers of primary close contacts, which is really over 4,000, some of the work of messaging and testing, etc., organizing that group has been centralized through a call center system. But for the active case and contact tracing, that's been done locally through the Goulburn Valley Public Health Unit. Now that split is essential, because otherwise the contact tracers would have to be looking after these 4,000 people, and whereas what they really have to do is focus on the cases. So when you get confused messages, which we try to avoid, and I've seen in the chat there is some confused messaging, that's because of this. It's unavoidable because of the big numbers. So be patient, ask questions, and try to follow to the best of your ability the rules. And if you're not sure about them, check in to find out what you might have to do if you've been given 2 messages, or if you're haven't been contacted at all. So just a couple of things about tiers. So a tier, there are really only important, there are 3 tiers really. The first one is tier 3, which means any symptom, anytime, anyone, means Matt, means me, means all of you. As soon as you get that sore throat, cough, runny nose, you just stop, go and get tested and isolate till you get your results. So that's effectively tier 3. Tier 2 is when the public health assessment is that you've been somewhere where there's a case. You haven't had enormously close contact, but there is some risk. That means you must immediately stop, go to get tested and isolate until you get a result. And generally you're free after that. Tier 1 is the more difficult one to live through. That means you have got a high risk of having been exposed. This means you must quarantine. Normally, we try to test everyone near the beginning of their time in quarantine. When there's a big strain on testing, we tend to prioritize that to the highest risk within the high risk category. And then you stay in quarantine. You come forward immediately with any symptoms to get a test, but otherwise you must stay in quarantine. And when we get to the end of that quarantine time, we do a test at day 13 to make sure that you are not only well, but your test is negative, and then you can be released and return to being a normal citizen again. So that's the structure. That's the only things we can do to control this virus until we're fully vaccinated. Now, we've been through this last year. We've been through it already this year. The situation is not hopeless. There is going to be a big change in policy, which you'll see progressively rolled out. So this will be the last winter of discontent where we're just all locked down all the time. And the reason for that will be vaccination. So that's the way out of this. We all get vaccinated. Once we're vaccinated at a very high rate, the risk of COVID causing major disruption to hospitals is eliminated. So while it may still circulate, and while we may have to accept that, with vaccination, you can break the link between severe illness and COVID infection. So that's the future, that's the way out. What we have to do in Shepparton now is hold the line, keep it under control, try to push it down and eliminate it, for us to have time to get to the situation where if it ever comes back, we're all protected through vaccination. I'll leave it there, I think, to leave plenty of time for questions. Thank you.
Thank you, Paul. So I wonder if just there was a fair bit of ground covered there, but I think just for the purpose of, there are a few questions, and I'm just watching the chat coming through. Could you just run through the tier structure again, please, Paul, and also explain what stop and stay means? We've had some clarification. Thanks. We'll get you allowed back in to come off mute. But I think this is a really important point in terms of allowing people to understand how that works. I think in a minute or two, if we can recover that plus
Sure.
Stop and stay.
Okay, so when we first identify a case, particularly in a school, we it's very hard to know with that first case whether it's widespread or not. And if you think about it, just one case in a large school, maybe over 1,000, the best thing to do is to snap freeze everybody in place until we understand how far spread it is. So that's a stop and stay order. That means assume you're going to be quarantined for 14 days, stop moving around, go home, stay home and wait. We then start testing ideally everyone, but we can't do that because of the volume required. So we test the most likely group to be infected. And with the information we get from that, we may be able to switch the status from a school or a large group that's been asked to stop and stay. So stop and stay is effectively we may be able to step down to tier 2 if we find very little or no transmission. So as an example, from Melbourne recently, 2 very large schools had cases in them. One of them, the assessment was that, so we started testing and we got no tests positive back. So that school switched from having to quarantine all teachers and all students for 14 days to all having a test and then being released. Another school at exactly the same time, the first round of tests, we got about 50 positives. So clearly it had already extended widely through that school. So that school all stayed in quarantine. So that's the way to get from the beginning to which tier you end up is stop and stay, get the first test results back. Then likely, unfortunately, with schools, we usually have to go the full 14 days. Therefore, it's tier 1. But sometimes we can, from the stop and stay information, go down to tier 2, which means everyone gets a test. Once you're all negative, you're released from quarantine. But then you have to return to stage 4 lockdown anyway. Is that clear enough, Matt?
Yeah, I think so. We'll reinforce it again later, but it's really, I think the main thing is stop and stay is stay in place. You're going to need to quarantine anyway for 14 days. The other thing is that we've been really specific about some particular class or year levels at certain schools that we're trying to target for the testing to give us that information that Paul and the epidemiologists can use to better understand why and what's happening with the outbreak. So they're important things, hopefully, that we can explain for people. So I'll now hand to you, Fung. So Fung's the Deputy Secretary Engagement and Delivery at the Department of Health in relation to the COVID-19 response. So over to you, Fung.
Okay, thanks very much, Matt. And I'd first like to acknowledge the traditional owners of the land on which we're meeting and pay my respects to elders past, present and emerging. I'll keep my comments relatively brief because I can see that there are a lot of people asking questions, and so probably it's best to provide opportunity for those questions to get answered in this session. But I'm here today just to give a bit of an overview of how the outbreak is progressing across the broader Victorian community. So at this stage, we have about a total of more than 500 active cases across Victoria at the moment. Of these, more than 100 are of children aged between 0 and 9. Another 100 are of children between the ages of 10 and 19, and 92 between the ages of 20 and 29. So there is a bit of a pattern in terms of the transmission we've seen across the community through this outbreak, that quite a large number of young people are infected. And you can see that also obviously in some of the cases which have come in Shepparton as well. In just in the last day, we had 50 cases which were in today's numbers. These 40 have been linked to known outbreaks, but about 10 of those, they're still under investigation in terms of their acquisition source. And only 11 of those people who were infected today were in isolation for their entirety of their infectious period. So this means that the number of exposure sites and unfortunately the number of people who may have been exposed to the virus is continuing to grow. So one of the things that we have been observing through this Delta outbreak and also the outbreak that preceded it, the one which led to the previous lockdown, is that it is a very transmissible version of COVID. So some of the transmissions that we have seen have occurred through quite fleeting contacts. So people who have just been in the same shop, or people who've been in the same sporting stadium, people who've just passed each other in the queue to an event or something like that. So this is one of the reasons why we have had to apply these this approach to isolating people in in exposure sites because of the extreme transmissibility of the virus. The other thing we've seen also is that a number of people have that within families, it's extremely transmissible. It's often been the case that if one person in a family gets infected with COVID, almost everybody in that family gets infected with COVID. So that's another reason why it's been very important for us to lock down whole families when there's been a case in that family, or where somebody has been a high risk primary close contact. Other things that we have seen is that while some people exhibit symptoms really, really quickly and become infectious very quickly, for other people, that it can incubate for a reasonable period of time, and it only becomes detected at the end of their incubation period around day 12 or day 13. So again, this is one of the important reasons why we have the whole quarantining period for the whole 14 days and the day 30, because some people are only becoming positive after a number of days in isolation. So that gives you a bit of a sense of some of the things that we've observed in terms of the broader community outbreak. The other thing I think I should emphasize is that it's not something that's particular to any particular social class or demographic across our community. It's something that we have seen a whole range of different communities across geographic areas have unfortunately become infected across quite different professions. So in some cases ranging from people living in public housing to people who are in quite affluent areas in Melbourne. So it has been quite a wide-ranging virus, which doesn't discriminate, as it were, between different groups of people. So in that context, it's really important that all of us continue to adhere very strongly to the guidelines and the restrictions from the Chief Health Officer. We have been able to get on top of Delta outbreaks before, and if we all follow those directions, then that's the best way for us to be able to get out of that, out of our current situation. So these restrictions include making sure that, in particular, we get tested as soon as possible if any of us have symptoms. So one of the things that has been a bit challenging in this outbreak is sometimes people have left it a couple of days before they get tested after having had symptoms. And if you leave it too long, if you leave it even 2 or 3 days, that means that can add to the number of exposure sites and the risk of transmitting COVID to other people. So if you have even the merest symptoms, a sort of scratchy throat or a runny nose, those sorts of things, it's really important to get tested as soon as possible. Secondly, it's really important that people wear masks everywhere when leaving their home. So we do have lots of evidence that masks are really effective in reducing the transmission risk of COVID. So that's one of the simplest and easiest ways to protect both ourselves and also our families. Thirdly, as we've been discussing earlier through this conversation, being across those exposure sites and making sure you follow the guidance that's associated with those exposure sites is really important. This makes sure that both you and your families are able to be protected as soon as possible. And fourthly, in terms of isolation, it's really important to follow the guidance around, if you have been in an exposure site, the guidance around what's the appropriate course of action for you to take. And I'm sure Paul and Matt can talk about those further should we need to. And I'm noticing there's a fair few questions about those in the chat. Finally, and of course, most importantly, as Paul said, we do have a way through this ultimately, which is through vaccination. So the more that you can, if you're eligible, that you can encourage both yourself and your family members and other members or friends that you know, the more of us get vaccinated, the more likely that we as a community will be able to get through this. So thanks very much, Matt, and back over to you.
Thank you. Thanks, Phil. So lots of information that we're sharing. The best place that people can find information about outbreaks, general queries you might have in regards to coronavirus is the Department of Health website, which is coronavirus.vic.gov.au. There's also a hotline, which is 1-800-675-398. Though the website and that phone number, you can actually use that to book a vaccine, which is what Fung just talked about. And I understand that there's been a further announcement today by the Premier in relation to opening up of vaccinations for younger people to access Pfizer, so which is great news. We will move to some questions now, but it was remiss of me earlier not to mention Linda and Nina, who are helping us out today, who are both doing a great job with some interpreting services, and they'll be changing to give each other a break during the course of this live broadcast. So, Paul, I'll get you maybe just to provide some guidance and response in relation to day 13 testing. And just while Paul's coming off mute, there's a couple of questions I'll answer in relation to items in the chat that I can see. The first one is if the police and ADF are going to be doing the door knocking and the home engagement. I know that's started today, and there'll be some additional ADF personnel to work with the Department of Families and Fairness in regards to the engagement and checking program to see how people are doing and make sure that they're okay, and see if they need any support as well while they're quarantining. The stop and stay information has not been published on the department's website because it's a relatively new innovation, I suppose, that's being used. And you have large groups of students at schools where we want to just, as Paul said before, get a lockdown or a freeze on people that have been in those locations so that we're able to test them quickly and understand what's happening. So the final thing in relation to the exposure sites and why there's a delay in them being listed, sometimes there's information that's made available and shared by social media platforms and the like, which means that that information gets out more quickly than what it can be officially reviewed and released to the department's websites. In the scheme of things, and in fact, I think maybe the post I put tonight about one of the school locations may not have been on the department's website. The reason that that can occur is it does sometimes, unfortunately, take some time for that to be made available on the department's website. But what we're committed to doing is when we're aware of and confident that there's an area of concern, we're trying to provide that information through to the community as quickly as possible. So, Paul, I might get you just to talk about some of those issues in relation to day 13 testing, how that works and what people might expect from that point of view.
Okay, thanks, Matt. So the purpose of quarantine is for 14 days is because if you've been exposed to the virus, even though your initial test may be negative if you've had an initial test, we can't be sure that you're not going to develop the virus on day 3, day 4, day 5, anytime up until day 14. Now, if you're going to become positive, it mostly happens before then, but it's put out at that distance to catch 95% of people or 100% of people if we're lucky. So the day 13 test is actually a requirement under the Act of the Emergency Act that you must quarantine for 14 days once you're listed as a primary close contact, and you can only be released with a negative test. Ideally, the test will be performed on day 14, but that doesn't give you enough time really to reliably get a result to release you at the end of 14 days. So that's why it's day 13. It's a bit strange, I know. That's the reason for it. So in your quarantine period, if you stay well and everyone's well, it's increasingly likely that your day 13 test will be negative. And of course, if you develop symptoms, things change and you must immediately at that point, whatever it is, day 4, day 3, get the test. And if it's negative and you get better, then you still have to get that day 13 test to guarantee that you're not going to develop COVID just as you leave. So that's the process. It's pretty easy if there's just one of you. There's going to be something like 4,000 plus people at approximately the same time here in Shepparton trying to get access to day 13 testing. And so there will be a very big demand that is being planned for as best we can. So we will try to make it as easy as possible, but we will also have to all be patient and understanding. As for the question about why is the website and things a bit behind? Well, it's a big job centrally to take all of the sites and get them up in an organized way and check that all the details are right. So you may well find information through social media or through word of mouth even that's ahead. That's fine. We're all in this together. If we all understand what what to do, we can act before that information's up there. So if you know something is up and it's reliable source that you have, then act on it yourself and work with us to protect each other. We each have to do our bit, I guess, is the answer to that. So I'll just leave that. And Matt, you're listening to me. Can you just let me know whether you think that was a clear enough explanation? I'm happy to go back through it. Thanks.
Yeah, we'll scroll down and see if there's any more questions in relation to day 13 testing.
I saw a question, does a test after day 13 count? Yes. So there are a few people who, for their own reasons, refuse to have any tests. Now, we can't make you have a test, but we can make you stay in quarantine. So we would give you, you'd have 28 days of quarantine if you don't want to be tested. If due to congestion and you can't have your day 13 test until day 14, well, that's fine. That isn't a problem. It just means you have one extra day in quarantine. If you do your day 13 test at day 10 and it's negative, well, that's really good, except you still need a day 13 test.
Okay. Thanks, Paul. Thank you, Paul. So just a comment around the testing capacity. So as I mentioned before, maybe in a couple of other forums, the sheer volume of people and how quickly this outbreak occurred in relation to the exposure sites was somewhat of a surprise. To be honest with you, I'm not sure that we could have ever planned to mount a response for that we've had to in relation to mounting such a significant testing response. So at this stage, we're still, based on what we know at the moment, expecting that there's going to need to test around about 15,000 people from when we first learned of the outbreak through to these last few days. We've increased the capacity really quickly. We now have around about 3,500 testing people that could be tested each day, and we're trying to increase that capacity by opening the hours and working through that. But it's not a service that we routinely have people ready to commence as and when, like on standby, I guess you could say. And the other thing, as I mentioned earlier, we've been severely limited in terms of what staff we can dedicate to the testing effort because a number of people have furloughed themselves, as I said, over 400 of our staff. I'm just going to scroll down to a few more questions. Sorry.
I've been asked to define day 1 and day 0. These are good questions.
Thank you. Yeah.
So day 0, let's say you're at a school where there's been some cases and you're in a class where there's been a case. Day 0 is the day you leave the risk. So we sometimes call that break of contact. So if you're in a class on Wednesday, you get told you have to go home on Wednesday and you leave the risk, that's day 0. And then day 1 is the first day after day 0. So your count, if you leave the risk on a Wednesday, day 1 would be the Thursday straight afterwards, and then you have 14 days counting that Thursday as the first day of quarantine. And technically, legally, you're released at 11:59 p.m. on the 14th day, provided you have a negative day 13 test.
All right. So just looking at so MARUTNA Primary is stop and stay at this stage until we get some more information. I think I did see a question there before about, sorry, I'm just trying to find the name of the primary school. The St Mary's Primary School in MARUTNA. It's only the students that attended the after school program on last Friday from St Mary's, but otherwise it's all of the MARUTNA Primary School students that we're bringing forward for testing.
I saw a question, Matt, about what if I'm not a close contact at Notre Dame, what do I do?
Yeah.
So at the moment, in any stop and stay situation, but at the moment, you're effectively defined, everyone is defined as a close contact. So effectively the whole school is tier 1. So you stay, that's the beginning of stop and stay is the beginning, and you should assume the worst, which you're going to stay tier 1 in quarantine until the end. However, if we find that there's no transmission outside the people who were closest to the case, and you're at a completely different year level and maybe weren't even on the same part of the school, then we may be able to, I can't promise this, sub-stratify, and so change the status of some people to category 2, which means they just have to test and isolate and then get released early if they have a negative result. So that's the answer to that. Everyone at Notre Dame right now is considered as if they're tier 1 until told otherwise.
Okay. So St. Brendan's is stop and stay location.
I just saw a good question about what about everybody else in the house. So when you have a primary close contact in a house, e.g. somebody who was at school quarantine, then the people living in the house with that person, their family, are actually called secondary close contacts or household close contacts. And if you're all living together, you all have to quarantine together. But the only person who needs to be tested is the primary close contact. And that person, so you quarantine together. If the primary close contact stays well and you all stay well, then the primary close contact gets the day 13 test. If negative, gets cleared by virtue, and then you're all cleared together. Now, why are we doing this? We're doing this because when somebody in your house gets Delta strain COVID, everyone else gets it too. So if you're all out and about and just the primary close contact is at home, by the time we found that out, you'll have COVID and you will have spread it all over the place. So that's the reason behind it. But the secondary close contacts are not legally required to get tested. They can be released once the primary close contact is released. Everything changes though if you have symptoms, then you should come forward, whoever you are.
I think there's another question there, Paul, about, I don't think we've covered this one, about people. So the specific question is, do you have to show the email letter from the department for the day 13 test because some of them don't have it and can't get through to the hotline?
Was that about don't have a day 13 test? I don't think people are coming up for day 13 right now. Is that what they mean? Or okay,
that's yeah. So they should receive. People should receive some communication from the department or contact tracing team about when their day 13 is and
correct.
The testing that's required.
So if you have been told to be in quarantine, then the system should list you in the computer and you should get a call and hopefully an initial test, but it may be that it's just too overwhelmed to manage that part. Nevertheless, because we all understand what to do, we stay in place, come forward with any symptoms. If not, stay in place, then come forward for the day 13 test. And once you've got that, you will definitely get a text saying you've got a negative result from the testing system. And if you don't hear anything and you're still well at day 14, then it may be that the system has missed you. It's more likely it's just a bit behind, but that's okay. So by understanding what we're doing, we can all help with the gaps that are appearing due to the stress on the system. I hope that makes it clear, but just about everyone will be contacted at some stage before the day 13 test. Thanks.
Paul, would you like to just make a comment about, I think, the issue of bus routes? And so the students in Shepparton and the way the bus routes work is that lots of students mingle through the bus networks and systems. There has been some questions asked about that. Are you able to comment on that,
yes,
please?
So we've got two big pushes being led by the team in the Goulburn Valley Health contact tracing system. One is a sort of a vertical approach where schools are stopped and stayed and then mostly tier 1. And so we're testing everyone through the school. But there's also a more bespoke horizontal contact tracing system where we're talking to the people who are the cases, their close friends, the friends of the friends, and getting urgent testing done that way to try to find people who are not identifiable through the big vertical approach, which includes people who travel together and play together or in the same group outside the school, but are not picked up within a school group. So it's a difficult problem, but we are trying to address that. Now, there are some buses which may have been specifically listed. I'm not sure about that detail, but we are certainly working along the chains close to where the cases actually are, so that we can see how much spread has happened, and if we can pick that issue up, that people who are a friend of a case but are not in the right class, perhaps at a different school that hasn't been stopped and stayed, can be picked up that way. Thanks.
And then, Paul, another query. I don't know if you've covered this as well, but there is a question there which may apply to households where there's a number of people living, say, in a family or different mixed group, where they've got. So the question is, there's a number of people in the house that are tier 1.
Yes.
But they've been at different locations that are tier 1, so they have different tier 1 days.
So tier 1.
What day is their day 13?
Yeah. So if you all, let's say there's 10 of you in a house, and then you all split into 10 different motel rooms with 10 different en-suites, then your own clock applies to you. But if you're all together, then the most conservative clock applies. So you have to stay in quarantine until the latest person is cleared. So you may as well wait and or get the test on the latest person's day 13, because if you get a negative day 13, but you're living with someone else who's in a primary close contact who still has to quarantine for 5 more days, you can't be released. You can see why, can't you? Because if you're released, but that person develops COVID on day 9, then you're infected and we're back to where we were. So it's the most conservative clock, or the most disappointing clock, you can put it if you want to remember it. So that's the clock by which you go unless you are separated, and then you can run your own clock.
Okay. There's a question there. It's a relatively specific one, but it's, I'm assuming if someone's in quarantine, that's in quarantine, can they get the mail out of the mailbox, Paul?
I haven't actually been asked that one again. The way I would think about that is that your mailbox is really your own property. So you're not allowed to leave your property, but the mail, you are allowed to go into the garden, but you wouldn't want to go there when there's anyone else walking past. So have a look out the window, make sure it's all clear, and then come back in. And other than that, you can't leave your premises except to get tested, or in an emergency such as fire, serious medical problem, family violence, that sort of situation. We immediately understand and overrides your quarantine requirement.
So there's a few questions in there. Hopefully we've covered that off in relation to different day 13. So it's the person who has the latest day 13 is when it's going to apply for any other household members. So you
kind of, if you live together, you day 13 together, I think is a good way of putting it. Now, if you're not a primary close contact, though, you're just a secondary close contact. You don't actually have a day 13, but you have your primary close contacts one. So that person, you don't have to yourself get tested. The primary close contact can clear you by being negative. But if you're also, if 3 or 4 of you are primary close contacts living together, then you all have to adopt the latest clock, shall we say.
Yeah. And another question there about day 13, is that from the date exposed or the day of first test? I think that's something.
No, it's day 13 of quarantine. So day 0 was the last day you were exposed, And when you leave that exposure, that's called break of contact. That's your day 0. Day 1 is the first day after day 0, and day 13 is the 13th day after day 0. Does that make sense? So you start counting from 1 the day after you leave the risk. The day you leave the risk is day 0. The next day is day 1, and then you go up to day 13. And then day 14 is the last day of quarantine.
Good. And thanks, Hugh, for popping that in there. So there is a link in the chat there for people who may be experiencing hardship or need some additional payments or the like in relation to being at home on a stop and stay or a home quarantine order. So Hugh Varley's popped that in there. There's a link to the department's website. The question there in relation to, I'll answer this question in relation to the specific question is, how are the schools under stop and stay orders communicating to non-English speaking families in the community? There is a dedicated group of people that are meeting daily, a communications and engagement group, and they have people involved from council, the Ethnic Council with Chris Hazelman, and a range of other service providers, both formal organisations and informal networks, liaising with the Department of Health and ourselves and other service providers in relation to getting translated material out to homes and other businesses that may still be open, of course, in order to be able to share that information with different cultural groups in the community. So more broadly, that is something that I know has been an active focus for that particular group right throughout this current outbreak, as it was last outbreak. Okay. Paul, it might be worth just responding in relation to people receiving text messages and other forms of communication, but what they should do in terms of receiving, when they receive that text message and the time between when they will get a call from the contact tracing team or the other parts of the department.
Okay, if you're a case, we'll call you very quickly and it'll come from almost always the local public health unit here, but sometimes when we're too busy, it might be from Loddon Mallee. So that's a small, it's big number, like I said, 47, but it's way, way smaller than the 4,000 primary close contacts. If you're a primary close contact, you are likely to get a text and then they will catch up with you and hopefully fairly soon, but maybe later than you'd hope. Meanwhile, because we all know what to do and we understand what day 0 and day 0, and day 1 is, we can look after ourselves and be patient and hope. If you're, I saw some good questions about what if you've lost your income by being put into quarantine. Well, if you are in quarantine, you're lawfully in quarantine. So we've required you to be there and also your household contacts. So therefore, you also have a right to have access to support. And Services Australia knows that. So if you're short of a letter, you don't have any evidence that you've been asked to lawfully quarantine, then you should get back to us. Now, exactly how to do that is difficult. There's a 1-800 number, which is often jammed up. You may wish to go through the school if it's caught up in the school, or I'm not sure, Matt, if you've got another way of helping people who are really stuck. You can't get through to the department, but desperately need a letter so that we can push them up the front of the queue. But I'll leave that to you to answer that question.
Yeah, I'm not sure offhand, but I think we'll take that one on notice and provide that response, Nicole, into our Facebook page in terms of where we can direct people and to council. We'll share that with council so that information can get out. Yeah.
And the other thing is, when we're lawfully asking you to quarantine, you don't starve. You don't have to. If you're running out of things, there is a system to support you, which you need to communicate with to get us a chance to help you. Things that are important, like scripts from pharmacy, which we can arrange for you, food supplies if you don't have enough. These things are all things that we need to supply. If you're not able to get access to those things yourself, it's obviously faster if you organise it. But if you can't for various reasons, please speak out and we can help.
So, Paul, I'll just give you a minute to collect your thoughts about just for everyone's benefit, we're not deliberately trying to ignore questions, and sorry if you think that's the case, that's not our intent. We're trying to move through the questions as they're appearing and get to as many of them as we can. One question that keeps coming up, Paul, which I'll give you the chance to think about, is how we're managing the Notre Dame campus and St Brendan's, because they're on the same campus and they're co-located. Just while Paul's gathering his thoughts, there's a couple of other helpful things there. Test results are generally coming back within 24 hours. There may at times, depending on what else is happening in the state, be a little bit of a delay. The bulk of the testing that's being done in Shepparton is actually being transported to Melbourne. So that builds in some delays just by virtue of geography. But generally, the turnaround times are in the order of about 24 hours, depending on the demand. There is also additional wastewater surveillance that we've introduced to some areas that we want to keep a really close eye from a public health point of view, such as aged care facilities in Shepparton as well, which are high risk locations. So Paul, if you're happy just to run through how we're managing Notre Dame and St Brendan's.
So I'm not right at the coalface. I'm just one level above that. But for Notre Dame, it's collecting the results from the inner group that's been tested today and yesterday, and making a decision then about whether we can release at the tier 2 level some parts of the school, or whether we think the virus is widespread, and we don't know the answer to that yet. The other school I don't know about. Have people been asked to stop and stay there as well, Matt? I'm not sure.
St Brendan's, yes, they're a shared campus.
Okay, so it'll be the same answer then for them, that we're waiting to see that first round of results, and that we will have those to hand, I'm sure, by tomorrow morning, if not already. So we'll be able to give clearer direction tomorrow.
Yeah. It is an important point, and we have called out specific, as I said earlier, class, or not so much classes, sorry, year levels or particular groups where we're really wanting to get some targeted testing done to give Paul and his colleagues the best information they can to understand what's happening at particular schools, so that then decisions can be made about tier 1 or tier 2 and the like.
And just as an example, the very first Delta outbreak we had actually occurred during the Kappa outbreak. So you might remember that one down in Melbourne. It was in the city of Whittlesea, the Kappa outbreak. Kappa is the strain before Delta. No longer to be found. Delta has wiped it out. There was a school in the inner West Melbourne, and they tier 1 the affected class level and let everyone else tier 2, and only to find new cases coming forward in other classes. So that was the first real evidence that Delta seems to behave differently from its predecessor, which is why we're so cautious with schools. So, and I know it's very frustrating for everybody not to know quite what's going to happen, but it's that abundance of caution and having been beaten already by not doing it, not going hard at the beginning, that has led to this approach. Thanks.
Paul, there's a question there about employers requesting copies of COVID-19 tests. That might even be a FONG question maybe, or Paul, but
there's no legal it's not enforceable that you reveal your personal medical information to anyone. They can ask you though for a DHS clearance. So that clearance will come at the end of your quarantine once the central system has seen the negative test. So all the negative tests will turn up centrally as well, and they will then release a clearance text so that you can, and that will only say that you are cleared. So your status changes from quarantine to cleared. So an employer may want to know that, and that's reasonable, but the actual result of your test is your own private business.
Okay. So thanks, Hugh. Thank you for answering that question. Sorry, I'm still trying to get, we've got over 200 questions and areas that we're trying to quickly scan and answer as best as we can.
I've just seen one that's a recurring theme that comes from Chris Spanning about if DH has said that if we fail to test at day 13, they get another 14 days, like another life sentence. So that they're saying that if they're answering a different question. That question is, what do I do if I don't get any test ever? I don't get a day 13 or a 14 or a 15. Then the answer is 28 days of quarantine. And there's a tiny number of people who choose that route. But if you get a day 14 test by mistake, you will be just cleared 1 day late. That's all. You just can't go and get a day 12 test, because then you have to have a day 13 anyway.
Yeah. There is a specific question there about parents from Notre Dame that have been at work. So Notre Dame again, stop and stay tier 1. Anyone who's a household contact of a student at Notre Dame or St Brendan's should not be at work.
That's correct.
So another question there about the MARUTNA after school care. It's specifically in relation to, so the MARUTNA primary school and after school care program, including students from St Mary's Primary School MARUTNA that attend the after school program only. And there's a specific date, which is Friday, the 20th of August, that we're concerned about. So it's only the students that go to after school care from the other school, St Mary's, but all of the MARUTNA primary school community. I think we're just about there. I understand. Okay, but we're happy to stay on for another few minutes. So there's a couple of questions there. I've got a note of them, and I might just answer. Just some of the responses might be a bit sensitive, so we might just see if we can contact some people in a more confidential and discreet way in relation to some of those.
Just say one other general thing. If, for example, you've got a critical business that really needs attention, and there's a primary close contact, e.g. your son or daughter at home, and you really have to find a way out of that. Well, there are ways out, including, for example, moving to a caravan, a separate roof with separate facilities on your property, and going to run your business from the caravan without going back into the house. But once you've separated, you have to stay there until the primary close contact has had a negative test. That's not the day 13 test, it's just an additional test. So in summary, if you separate from the primary close contact, and then after you have separated, the primary close contact returns a negative test, you're releasable as just a free citizen again. So that some people are using that to say sleep at work, or if they come from families that have with different parent arrangements, the children could go to one person, and then provided the primary close contact, the child tests negative after they've left the other house, then the people in that house, provided they're not otherwise tier 1, they're just household contacts, are released because their risk has gone away when the quarantine person has moved away. So that's another possibility to explore.
Okay. Paul, just could you comment on the question that is in relation to if there's a tier 2 site, do all household members need to isolate, or only the person who attended the tier 2 site?
Only the person who attended the tier 2. They should go straight to test. Then they should go and lock themselves in their bedroom, or as best they can separate from everyone else as much as practicable. But certainly don't share dinner together in front of the TV until you get that negative result. Thanks.
Yeah, and of course, anyone who has symptoms in that house or even should be coming forward for testing. There's no further information on the Boucher Street Primary School just yet. So anyone that's associated with that school should just remain in the stop and stay until we get some more testing results and intelligence about what's happening from that perspective. I think we are almost at the end of the questions.
There's just one I saw about, I think it
Sure.
says it's about Aqua Moves, and the person's saying it's listed as tier 2, but I've been classified as tier 1. What does that mean? No, I don't know the specific story about Aqua Moves, but in general, you can be tier 2 because you went to somewhere, but while you were there, you might have been sharing the same desk, for example, with the case, and that makes you a primary close contact. So therefore, you can be both tier 2 and tier 1 at the same time, because you went to an exposure site, but also while you were there, you had close contact with the case. In that situation, you can get confusing messages, but what you do is follow that same thing. You take the most conservative one. So you go with the fact that you're a primary close contact and you must quarantine, and so must your household.
One other one for you, Paul. The question is, I've been informed if you are not in the time stated at the exposure site, can you be excluded from the isolation times as you are not at the exposure sites during the designated times?
Yes, if you didn't come near the case, then you're just a citizen. However, you might have been caught up in the system and recorded as a primary or secondary close contact, a primary close contact, in which case the system will think that's what you are. So then you need to contact the system and let us know why you need to be reclassified. And the reason for that is when you're classified as a primary close contact, you're under a legal obligation, and there is checking that goes on. So there are visits. So if you feel that you've been incorrectly labeled, then that could well be right. There may be a mistake there. And there is a system by which you can appeal and get your classification changed, either downgraded or completely released.
Couple of other questions there about arranging for your second vaccination shot. If it falls during your quarantine, you should
stay at home. That's right. So you will have to postpone your vaccination, because what we don't want is people who are just developing COVID going and get vaccinated, because that then takes out the vaccination team. And the problem with COVID is although most people do get symptoms, the 2 days before they get their symptoms is the virus is at quite a high level, and you often transmit it unknowingly in that period. So we don't want that.
And a question that came up before, your employer cannot legally ask for a copy of, that was the test result. I'm not sure about the vaccination passport. Sorry, Paul, do you?
Vaccination passports are great. They may become legally required. So for example, Qantas is requiring its employees to have these things. So that's a private decision made within their company. So if your company decides that that's their policy, then that may be something that is part of your EBA and you have to do. It's not a requirement from the public health unit to show anybody that. Now, with respect to your own test result, you're free to do what you want with your own business. So you can show someone your test result if you want to, but they can't compel you to show it to them. But the legal system can ask, are you officially cleared from quarantine? And to show evidence of that yes, before you come back to work.
The question, sorry, I have seen that's popped up there a few times in relation to the Coulson Centre. We'll take that one on notice and put some information on our Facebook page about that. If it's not tonight, it'll be in the morning, and to clarify that one. So I think we're almost there. So yeah, another query about Boucher Street. Boucher Street still is stop and stay tier 1. There's some queries about St. Luke's and Emmaus. We'll take that on notice as well and provide some clarification about those two campuses in relation to Notre Dame. Yeah, there's a question there about the Sky Salon, the hairdressing salon. Our post on Facebook on the 5th for the date range we're concerned about is the 15th to the 20th, and it'll just be that there's some time delay in updating the department's website. As I mentioned earlier, when we're getting information like this that we are a bit concerned about certain sites, we're putting it out into the community more quickly. So anyone who has been at the Sky Salon during those date ranges, please come forward and get tested. All right, I think we might wrap it up there. I think I've managed to scroll to the bottom of the page, so that hadn't happened since we started. So I'd just like to thank Paul for giving up his time. Paul does live in Melbourne, and he is staying here in Shepparton with us for this week and has proved an invaluable support to us in the last few days. So thanks, Paul, for giving up your time tonight and helping out our community in a different way. I'd also like to thank Fung Pham as well. So Fung did provide some information earlier, but behind the scenes, Fung and his team has been working really closely with us to set up the testing sites and have done a great job in mobilising the additional resources during the course of the last few days. As we said earlier, it's really important from now on that anyone, and this is always the case, if you've got symptoms of COVID-19 at any time, you should always go and get tested. The other thing is don't delay it. I mean, what we're seeing in not only in relation to this outbreak, but in relation to other outbreaks, is that people are putting off getting tested when they are symptomatic. And we really can't afford for that to happen, because it's a bit like a spot fire turning into a bushfire. If it's left unchecked, it can get out of control very quickly, and we certainly don't want that to happen. So get tested and get tested straight away. Please continue to do all those things like wearing a mask, keeping your distance, sanitizing your hands. And most importantly, one of the things that we're being challenged with at the moment is that some people aren't using QR codes and checking in, and that's really slowing down our contact tracing effort. So please make sure you use the QR codes when you're scanning in to sites. There's a whole range of information available that on the department's website. So that's coronavirus.vic.gov.au, and you can call 1800 675 398 in relation to not only coronavirus, but support and other services that are available. And of course, we want everybody to get vaccinated. That's the only way we're really going to knock this thing over. And we'd really like that to happen, to land that knockout blow one day. So again, thanks to Paul and Fung. Also, thank you to Linda and Lisa for your interpreting. It's been great to have you on board. I'd also like to thank the Greater Shepparton City Council for hosting the event. We've actually used their Zoom platform for this event. You've done a really terrific job in helping us not only tonight, but Council have done a power of work behind the scenes in supporting us to set up the testing sites at the various locations around Shepparton and MARUTNA. So thank you, everyone. We did get on top of this last year. We will get on top of it again this year. If everybody keeps doing their little bit, that's the sum of the parts that will get us over the line. So thanks again, everyone, and all the best.